So my name is David Cameron, and today I'm gonna visit the doctor for my physical checkup, for my annual physical. I'm a diabetic, but I haven't really experienced any issues so far, and I'm expecting this to be pretty short.
Hello, I see you'll be the interpreter today. It's nice to meet you. Today I'll be meeting with David Cameron, just a regular checkup. Hello, David. It's nice to see you again. How have you been?
Oh, I've been great. Life has been grand. No problems here.
That's great to hear. Well, I think we'll get started. Do you have any complaints or concerns about your health?
Well, not really. Can't think of anything. Just came here for my checkup to make sure everything's in working order.
That's a good idea. We will do all of the regular testing, and if you think of anything else you need, just let me know.
Awesome. Thank you so much.
I'll start with a few questions. Since the last time I saw you, have you started smoking?
Oh, no, absolutely not. I'm not a smoker.
Good. What about excessive alcohol consumption? Do you typically have more than 7 alcoholic beverages each week?
No. I wouldn't say that much. In a week, probably have about 1 or 2 drinks.
Wonderful. Last time we met, we discussed improving your diet and exercise. What has your diet and exercise looked like this year?
Yeah, sometimes it's pretty good, but sometimes I have my lazy days. And sometimes sticking to that diet is really hard. I try to get all my vegetables and my protein in, but, varying degrees of success. But I've been noticing my blood sugar levels have been pretty stable, so I try to exercise for 30 minutes every single day, and that's been doing good so far.
Lazy days are okay. Just make sure it's not becoming a habit. It sounds like you're doing really well, so I have no worries. I see the nurse checked your vitals. She said everything looked good.
Oh, really? Because the nurse said that she was concerned about my blood pressure. She said it was pretty low. Did you notice that?
Your blood pressure is 136/84. That's a little bit high. I would say that's borderline hypertension, so it is a little bit higher than normal.
Oh, all right then. Well, how do I lower my blood pressure?
There are a few things you can do, but I'm curious, are you getting enough sleep each night?
Well, really? I'm tossing and turning all night long. It's hard for me to get a good night's sleep. And that's kind of been a common theme all my life, so I'm not too concerned about it.
That's really good information to know. People who have sleep problems, like sleep apnea, tend to have higher blood pressure levels. So we can do a sleep apnea test while you're here if you'd like.
Oh, yeah, that'd be great. I'd love to get that done today. If I have a medical problem, is there any medicine to help with that for the sleep problems?
No, there aren't any medications that would really help with sleep apnea. If you do have sleep apnea, you can start using a CPAP machine each night to help control your breathing during sleep and hopefully lower your blood pressure.
They missed the theme completely.
Oh, okay. All right. Good to know. Do you mind if we take the test right now?
Absolutely, we can do that for you. Everything else looks great. Do you have any other concerns?
Trying to think of something. Well, nothing's coming to mind. Thank you so much. I really appreciate it.
Hello, Mr. Brown. Hello, Mrs. Brown. I'm Dr. Rendell. It's very good to meet you. What problem brought you here today?
Man, I've been breathing real heavy and sweating a lot. So I got in the car to meet here today because my wife has just been nagging me to get to the hospital. So I thought maybe we'd get a checkup. I'm pretty concerned about my lungs.
How long have you had this problem?
Maybe like the last 2 or 3 weeks. It's been really hard to breathe and I've been sweating a lot, but I've been really trying to put it off. But I'm here now.
Okay. You mentioned shortness of breath trying to catch the bus in the morning. Are you short of breath walking on the level? About how
Yeah,
far?
typically when I'm walking pretty fast. Like 2 or 3 blocks.
Okay. What about stairs? Is that difficult for you?
Oh yeah, for sure. I gotta go up real slow. It's a struggle.
I mean, they are too good at conversation for math majors. They would probably be like,
Okay. What's your occupation?
I work as a
Are
janitor.
there any activities that you have difficulty with at work?
Howard. It's pretty hard to mop because it's a lot of effort to be mopping like that, and it makes breathing a lot more difficult. Maybe I just think I gotta lose weight. I am overweight right now.
Do you mow the lawn at your house?
Yeah, and that's a struggle too. But I need a better machine, I think. Mine's a piece of junk.
All right. How many do you get short of breath when you sleep? When you lie flat?
Yeah. You were really struggling. I could see you breathing. Especially, you weren't even exercising or anything. You were just laying
How many
down and you
pillows
were
do
out of
sleep
breath.
with?
Like 1 or 2 pillows.
When you wake up short of breath, what do you do?
I try to drink some water, and that usually helps.
Is it better if you stand up? Or sit up?
Yeah, when I get up, I feel pretty okay. When I sit, it definitely helps a lot. But if I'm moving around, well, yeah, that's when the breathing
Do you
problems
smoke?
pop up.
Do you have a problem with
No.
diabetes?
Yeah, I have diabetes.
How many years?
My wife's better with numbers than I am. Do you know how long it's been? It's like 21, 20 years? Yeah, like 20 years.
Okay. Do you have high cholesterol?
No, no.
Has your doctor ever told you what your cholesterol was?
It was like 200. I think it was like 209. It was
Has
something.
Dr. Johnson put you on medicines for that?
Yeah. There's like 3 of them. Trex, TP, Tylenol, X,
Toprol?
Toprol.
Toprol?
TOP. Yeah, that's that one.
And do you take Lipitor or Zocor for cholesterol? Do you take an
Yeah, I
aspirin
do.
every day?
Yeah, it's baby aspirin.
And you take shots for insulin? Okay.
Yep.
Have you been in the hospital before?
I'll be back.
For what?
Yeah, I have. For surgery on my legs.
Okay. Have you ever been in the hospital with your diabetes?
Oh, yeah. It was a long time ago. It was when I still had diabetes when I had my leg surgery. No, you went there for TB and then it was nothing. Yeah, something like that.
Any other hospital stays? Okay.
Okay.
How many people live in your household?
Me, my son. We have one son. But he's a college student or recent grad, just graduated high school. And then my daughter's in Wisconsin, so it's just the 3 of us.
Do you drink alcohol?
Nope, nothing.
Do you do any street drugs in the past or present?
Nope, nothing.
Okay. Any other health problems?
No. Well, he gets really fatigued easily while walking. So that's one. And he thinks it's normal, but I've been pretty concerned about it. Maybe, like, I'm worried that he might fall, or he insists that it's normal, but he can't even keep up with me when I'm walking. He just has to sleep after every time he walks.
Has anyone in your family had heart problems?
Nope, no. Arthritis and TB.
And your father's?
And stress. No, my father's passed away, so I don't know.
Are your parents alive?
My mom's alive, and my dad has passed away.
And what did he die of?
It was a long time. He was a smoker his whole life, so yeah, I think that's what got him. Did your father have cancer in his knee? And then it spread to his lungs? Oh, yeah, that's right. They found a tumor in his knee, and then he let it go on for too long, and it spread to other parts of his body, and he passed away. But besides that, I don't really know the reason.
I'd like to examine you. Could you have a seat at the exam table?
Yep, sure.
Hello.
Hello. I need to refill my medication, my inhaler.
All right, well, that should just take a few minutes.
Bye, Claire. Are you leaving?
No, I'm just bringing my stuff down.
Oh, okay, okay.
Oh, I see, but when you got it last, it's been used up a little bit quicker than it should be.
What I missed? What I missed?
Have you been having problems with your asthma?
Yeah, I have to use my inhaler every day.
You've been coughing and having shortness of breath?
Yep, yeah, lots of shortness of breath.
Do you use anything else for your asthma?
No, I just usually use that. But my doctor, he gave me a sample of something.
Okay.
I don't use that one though.
Does it look like this? Advil?
Yep.
That.
Yeah, it's something like that. I think that's right.
Okay. And the doctor gave you a sample, so I'll check with your doctor, and if you come back in a half an hour or so, I should have that prescription for you. Okay?
Okay, perfect. Thank you
You're
so
welcome.
much. That was cute.
Your prescriptions are all set. I would like to just go through this with you quickly. First of all, explain the importance of using your controller, the Advair. It helps prevent your asthma, the symptoms from occurring, so that you will be using less of the albuterol inhaler. It's healthier for your lungs to control the asthma.
Do I have to use that every day?
You need to use this every day. 1 puff in the morning and 1 puff in the evening.
Oh, okay.
Okay?
But what happens if I forget?
Then just, if you forget a dose, it's not a big deal, but try and remember. It'll just help keep your asthma under control. So you can.
Okay.
You don't need to carry this one. You can take a dose in the morning before you go to school or work, and you can take a dose in the evening before you go to bed. This one you should have with you at all times.
Yeah. Okay. And then could you show me how to use the other one?
Sure. You open it up, and then there's a little trigger here. There's powder in here. Okay, when you pull this trigger, it breaks open a capsule with powder, and then you inhale the powder very strongly, hold your breath for a few seconds, and then slowly exhale.
Okay.
Certainly.
Yeah. Can I see that again? Like this? And that's all?
Well, make sure you hold your breath for a few seconds if you can, and then slowly exhale. And then it is important that you rinse your mouth out. Just swish with some water and then spit that out after you've used your inhaler. This one.
Oh, okay. Got it. Thank you.
How are you with this one? Is your technique okay?
Yeah. I use that one all the
Well, maybe
time.
we'll just go over this quickly as long as you're here, just to make sure you're getting the full use out of this. Do you always shake it before you use it?
Yes, I.
Give it a good shake. I'm going to give you this extender to put on the end of it because it helps get the mist in the lungs as opposed to just hitting the back of your throat, or sometimes people miss altogether. So a little bit easier if you use this. Give it a shake before you use it. Exhale. Put your mouth there. Give it a squirt. And then immediately inhale. Hold it a few seconds and then slowly exhale.
Can I see that? Okay, so I shake it, put my mouth there, inhale after I press it, and then slowly exhale.
Yes. And if you're using 2 puffs at a time, usually people use 2 puffs. If you can wait a minute between puffs, the first one starts to work, and then the second one gets in a little bit deeper, so it works a little bit better.
Perfect, thank you.
Okay.
Got it.
It'll work better if you wait. I
Okay.
think you'll find if you're using this, you'll have less need to use that.
Thank you.
You're welcome.
Awesome, thanks.
We'll just put this in a bag for you and you'll be all set to go.
Thank you. Okay.
Hello.
Hello. How are you?
Fine. How are you doing today?
I'm doing okay. I'm keeping in there. I had problems with some of my medication, so I brought them in today to get them looked at.
Certainly. Should we sit down and look to see what you have?
Yeah, sure. That'd be great.
Well, let's take a look and see what medications that you're on. And that's the first one, hydrochlorothiazide. And you take this once a day. And what time of day do you take that?
I take that at night.
In the evening. Okay. And this one does tend to cause urinary output, and so you can keep you up at night. Most people take this in the morning, and that's probably a better time to take this in the morning, so you're not having to run to the bathroom in the evening.
Oh, yeah, well, I don't really have to. I have been running to the
I think
bathroom a
you'll
lot
find
at
that
night,
that'll
so.
help. And you're taking this for your blood pressure. Is your blood pressure being controlled pretty well? Do you know what your readings are?
Yeah, sometimes it's like the hundreds to the 90s-ish. Sometimes it's like 125. It fluctuates a lot, but it's not super high.
Okay, but the bottom number is 90 usually.
Yeah, typically around there.
That might be a little bit high. Maybe we'll have to talk to your doctor about adjusting your dose on this. 90 just tends to be a little bit high. You probably would want that a little bit lower.
Okay, yeah, no, for sure.
And the next one that you have here, glipizide for blood sugar. And what have
Yep.
I see you have your readings here. Can we take a look at those? Well, the readings look very, very good. Are you having any unusual symptoms, or are you feeling okay?
Yeah. No, it sucks. I feel like my heart has been going crazy whenever I take this, and I don't know why.
When do you have the sweats?
Maybe like a week ago it started.
Okay, what time of the day? Is it all during the day, or?
It's all day long. And sometimes even it's in the morning, but sometimes I'll have to wake up out of my sleep because my stomach really hurts and like my body's all sweaty and my heart is just beating like a drum.
All right. How about at night? Do you feel all right? Do you sleep all through the night pretty well?
Oh yeah, I sleep okay. I sleep all night long. But it's the daytime that's really causing me problems.
Okay. Well, since your readings look pretty good, the blood sugar readings are good, but you're having symptoms where you're gaining weight and you're not feeling well during the day, we may have to talk to your doctor about either adjusting the dose of this or maybe putting you on something entirely different that controls your blood sugar. There are lots of choices in medications for controlling blood sugar, so maybe this one is just not the one for you. There may be something else out there that you do better on and that does control your blood sugar. I can give your doctor a call and tell him that you're having these symptoms and see if we can get you set up with an appointment shortly so that he can adjust this or maybe switch you to something else. Does that sound all right?
Yeah, that all sounds good.
Okay, good. It's important to control your blood sugar, but it's also important that you feel good as well. And so if we're controlling blood sugar, but you're not feeling good, then that's something we need to work on. Okay?
Okay,
I'll give him a call.
awesome. Tell him that I use this one. It's better to have a lid like this, the pop-off lid, because it's really hard for me to use the child safety lock lid. Could you just let the doctor know that? And then it's really hard to read the labels on this as well, so if the print could be bigger, that would be really helpful. Because this child safety lock, it really hurts my hands.
We can make a note in your file that you want the easy open caps, and then you'll get those from now on. And we can also notate that you want large print on your labels, and that's something we can do too.
Perfect, thank you.
Good. Is there anything else that you would like to talk about today?
For this one, the liposide, I'm not sure. This might not be the right medicine for me. If we got rid of this one altogether, I'd be totally fine with it. It just doesn't work for me at all. So maybe if there is a better option for a blood sugar medication, that would be great.
Certainly, that sounds good. There are lots of choices. Used to be that we didn't have so much to pick from. Now there's a lot of different categories of medications that we can pick from, and I'm confident we'll find something that will work for you and that you can tolerate.
Yep, okay. I'm going to the nurse, but I've been waiting so long. And they were saying she's not in, and so I said, forget it, I'm gonna go to the pharmacy to get my meds instead.
Okay.
But I know about my sister. She's got something in her stomach that spread to her liver and her kidneys and her colon for 5 years. She's been taking meds constantly. And then now she's ran out. So I thought I could get it for her. I don't know, it's hard to spell the medication name. But they didn't let me get it, and it's worse. Do you think you could do that for me?
Is it osteoporosis that she had? Did you think that's what it was? Osteoporosis?
Yes, yeah, that's the right one. I don't know how to spell all that. That's a huge word.
Well, most women are at risk for developing osteoporosis. It really does not have anything to do with the cancer that she had, although that could have made it worse. But women are at risk for osteoporosis, which is a condition that makes your bones more brittle. And that puts you at risk for breaking hips and small fractures in your vertebrae, which are very painful. And the reason that women are... Yes, what happens is women that have osteoporosis tend to shrink because their vertebrae, there's fractures and they shrink down in size, and it's a painful situation.
Is there anything to help with that?
Yes, there is. As a matter of fact, it's calcium. It's just over the counter. You can buy calcium with vitamin D.
I drink a lot of milk. Do you think that's enough to help with osteoporosis?
It's either not drinking enough milk or getting calcium from other sources in your diet. You don't necessarily have to get calcium from milk, but most people don't get enough calcium in their diet. And so, especially women, and as I said, the reason that women are prone to osteoporosis is because your bones are less dense to begin with than males. And so men do get it, but at a much lower rate than women. And so what you should do is if you're not drinking 3 or 4 full glasses of milk every day, which I know I don't, then you should supplement your diet with calcium tablets. with vitamin D, because the calcium with vitamin D is more effective than just the calcium alone.
Yeah, I've got no idea. I totally haven't been drinking enough milk this whole time. So I'll take the calcium pills as well. But it's not dangerous for women. Like, I wasn't
Yes,
aware.
that will help. Sometimes it's not enough.
Okay, and you know what? I had my golden moment, and now it's done.